companies and their underground labs. It's also doubtful whether counterfeit black market products are subjected to appropriate sterilization processes. As a result, people are gambling with their health by using steroids and they purchase from online sources. Okay, good morning. Good to see you again, everybody. I'm going to speak this time about a topic that comes from bodybuilding as a bodybuilder. The intramuscular abscess as a result of anabolic androgenic steroids or oil injections of steroid solution, including also testosterone. So occasionally bodybuilders develop intramuscular abscess, septic or non-septic, meaning sterile. The main difference is that the former, that septic, develops all the clinical symptoms, inflammation, and deals with infection, while the latter deals just with hard lumps of oily solutions. In the long run, they can be calcified and turned into a scar tissue, that means fibrotic tissue. Now, the septic abscess is the result of contaminated injectable steroid solutions or non-sterile injection techniques. When you share needles, you reuse needles and syringes. Common areas include the buttocks, the gluteus maximus, the shoulders, and rarely the calves, the gastrocnemius. Now, oily androgenic anabolic steroid solutions usually do not become contaminated because the bacteria cannot live in this environment. However, water-based suspension solutions like stenozolol or testosterone suspension or even trenbolone base, they're among the riskier injectables that can develop contamination. Bacteria are likely to get cultivated in such solutions, and as a result, inflammation occurs. Now, gluteal and deltoid abscess have been reported among bodybuilders using spots that are local injection into specific muscle areas that allegedly is believed to increase localized muscle growth, which is a fraud, of course. This could be in the triceps, in the delts, in the biceps, in the traps, in the lats. Administration of large volumes of testosterone esters in one injection up to 5 ml is common, exposing an individual to sterile abscess formation where pathogenic organisms cannot be found. Now, what are the symptoms of the bacterial infection? Two main bacteria that are responsible for this is Staphylococcus aureus and Streptococcus, but also Pseudomonas, which is anaerobic. The basic signs of inflammation that we know in medicine is, first of all, the swelling, the edema, which is a result of the blood flow, of course, the erythema, the reddening, as a result also of increased blood flow, the elevated temperature, over 95 or 37 degrees, which is fever, also a result of the blood flow, the pain and the tenderness in the affected muscle as a result of the cytokines, and occasionally when the abscess is localized into the gluteal area, the athlete is not able to perform a hip flexion. This happens during squat, the negative phase, but also during leg press, during the negative phase, because under this movement, the sciatic nerve is stretched and becomes really painful. All of these symptoms are associated to the increased blood flow, since macrophages and neutrophils among the white blood cells are responsible for phagocytosis of the microbes. Generally, the abscess is a defensive mechanism of the immune system to prevent the spread of the infections of materials to the other parts of the body. So it's a defense mechanism. Now, the laboratory assessment of this, laboratory findings find leukocytosis, meaning white blood cells more than 10,000, and increased neutrophils, over 70%. Neutrophils are responsible for phagocytosis under bacterial infection. Elevated erythrocyte sedimentation rate, which is over 20, and the C-reactive protein over 5, which is more accurate, actually. Elevated CPK as a result of the intramuscular injections, that is also known as rhabdomyolysis, and elevated lactate dehydrogenase, LDH, which is a biochemical marker raised in tissue inflammation and cellular damage. Another useful assessment is the MRI that can show actually what is going on into the muscle tissue when we have an abscess, and shows the soft tissues in general, ligaments and the tendons. Now, how we manage and treat the abscess. Certainly, abscess should not be squeezed by the patient himself. If the abscess bursts under the skin and bacteria spread through the blood circulation to the body, it can result in a life-threatening blood infection known as sepsis. Sepsis symptoms include general fever, chills, nausea, vomiting, diarrhea, tachypnea, that means fast breathing, and this is because of the metabolic acidosis and a compensatory mechanism of the respiratory system to get rid of the CO2, and confusion. Sepsis always requires hospitalization. Is a very dangerous situation. Initially, steroid users should avoid injecting into the inflamed area, and we should rotate into different spots. Quitting from injections at least for 1 week, and the steroid users then use some orals in order to avoid the injections. The use of non-steroidal inflammatory drugs like sodium diclofenac, for instance, or dimethyl could provide some aid in the first place and fight the discomfort. Hypertonic solution based on aluminum provides pain relief when applied locally with a towel about 10 minutes 4 times daily. Now, a pharmaceutical medication that's very helpful to this is the serrapeptase enzyme. This drug is widely used in several cases that include septic and nonseptic inflammation when swelling is presented. The surgical management of this case, in most of the severe cases, surgical incision and drainage of the intramuscular abscess is obligatory. The surgeon cuts the skin and the fat beneath with a scalpel, entering into the inflamed area. This will give the opportunity for the drug, the oily solution, and the pus, which is the dead white blood cells, to leave the contaminated area that has to be extensively cleaned afterwards. As soon as the pus has been drained, the surgeon will insert some packing into the main cavity in order to minimize any further bleeding, and this happens for the next couple of days. As the scar heals, the patient can expect to be out of the gym for a couple of weeks. If it's a deeper abscess, then the surgeon may insert a drainage tube, and drainage is maintained for several days to prevent further spread of the inflammation. We have to cultivate then this pus, meaning the dead white blood cells, microbiological cultivation of biologic samples, and antibiogram that will provide the specific medication of the antibiotics are necessary. In most cases, the physician supplies a combination of different antibiotics, either for aerobic or anaerobic bacteria, like amoxicillin, for instance, or clavulanic acid. So we should not neglect, of course, that the side effects of the antibiotics include the extensive diarrhea and the GIT. Therefore, we should take lactobacillus from kefir or organic yogurt, or even from Peros. Now, in case of lactose intolerance, we use lactobacillus in capsules, as I said, Peros. Intramuscular abscess has to be cleaned up twice on a daily basis, as long as the patient follows antibiotic treatment. White blood cells count, erythrocyte sedimentation rate, and C-reactive protein are the laboratory evaluation that should be considered on a weekly basis. And this follow-up will provide details about the inflammation. Now, what are the prevention mechanisms? Rotation of the injection site and areas, So, along with extra caution of sterilization before and after the injections. Occasionally, we may switch to orals. Of course, they're more toxic, but we cannot inject when we have already inflammation and abscess. Pure ethanol, 95% must be used, before and after, as I said. Changing needles, of course. Subcutaneous injections of water-based solutions for growth hormone, HCG, or some peptides do not have so much tendency of infection because the adipose tissue is not that well supplied by blood flow, so unlikely the intramuscular tissue that is full of arteries and veins that provide an extensive circulation. Now, peptides are usually injected into the fat, like G8, like HCG, insulin, or other secretagogues, while the oily injections are injected intramuscularly. Well, we could have also subcutaneous oily injections, as the late John Clisett described a few years ago. Now we have here an FPB Pro with abscesses in his 2 gluteus maximus. And then we have an MRI over here that we can see the abscess into the pelvic area. Now, when we inject into the buttock muscle in the gluteus maximus, we have to be particularly careful about the needle do not to touch the sciatic nerve. Therefore, when we cut in 4 quarters the gluteus, the outer area is preferably to be used simply because the sciatic nerve comes from the other side. In case we hit the sciatic nerve, may happens also lower limb paralysis. The proper spot is upper and outer gluteal area. Now, when injecting, we ensure that no blood vessels are touched. Therefore, we respirate in order to avoid pinning simply the artery. And when we remove the needle, then if we're so unlucky that we have injected into the artery, then comes great pressure, the blood out of this spot. It's because of the pressure that have the arteries, the systemic blood pressure. Now, when a broken blood vessel causes internal bleeding, then you may feel pain and stiffness into the muscle. When a blood vessel breaks, scar tissue or blood clots can form. The bad scenario sometimes when we inject oil or even air into a vein, then this may lead to a pulmonary embolism because the veins are drained the blood to the inferior vena cava to the right heart and then to the lungs. And this is the bad scenario. Sometimes we cough when we are unlucky and we develop the pulmonary embolism. Most bodybuilders lack of knowledge to recognize the counterfeits. The counterfeits are those steroids that are not originally from pharmaceutical grade companies and they're underground labs. It's also doubtful whether counterfeit black market products are subjected to appropriate sterilization processes. As a result, people are gambling with their health by using steroids and they purchase from online sources. Sometimes the product is fairly pure and the user experiences all these results. Now, the Roid Kits by Bill Welling was a pioneer project that you could do qualitative measurement now if you have this particular compound, for instance, and that you're injecting. Now, personally, I have experience in intramuscular abscess 2011 when I had the brilliant idea to switch from pharmaceutical grade compounds, nonsterile, to an underground. And I developed, of course, abscess both in my deltoids and in my gluteus. I was fortunate at that time. I was doing my residency at the hospital, and my colleagues, my general surgeon colleagues, helped me to drain and clean all this. And I remember that my hematocrit for the first time dropped below 50%. And it was a horrible situation and life-threatening because it could develop to a sepsis by administrating the wrong antibiotics. Now, I remember that when I was using back then the steroids and I had to be operated, it was a risky scenario to get operated while you're on a cycle because your liver doesn't form well the clotting markers. So my INR was prolonged. That meaning the bleeding time was prolonged also. And I remember that I was partially under anesthesia, and I could hear the surgeon and I could smell the burning flesh because they told me that your bleeding was not stopping easily because of the steroid use, and they had to literally burn the arteries in order to stop the bleeding. So that's not a good scenario, and usually they administrate vitamin K intravenously. That's my presentation, and actually this was part of the Anabolics book 2017, the 11th edition by Bill Welling. That's all.
Speaking of support, have you subscribed to our channel yet? If not, consider doing so now. We'd be chuffed if we had you on board to our community of wellness enthusiasts. Hit the notification bell, it'll keep you in the loop so you won't miss out on the latest natter about health and balance, and you'll get the YouTube video directly to you. And if you've enjoyed this video, there's plenty more where it came from. We have a wealth of different videos exploring various corners of health and well-being. Speaking of which, why not take a look at these? They're a few of our favorites, and we reckon you'll find them particularly enlightening. We've barely scratched the surface today. For more insight into hormonal health, why not explore our channel? We've got a wealth of content awaiting your attention, and you can also visit our website at balancemyhormones.co.uk. So, this is Mike from Balance My Hormones, your beacon in the fascinating world of hormonal health. And until next time, remember, knowledge is power, and your journey to wellness starts here with Balance My Hormones.